Hi guys, it's Kirsten and Sydney here with Bellevue Physical Therapy at our Papillion location. Today we're going to tell you about some soft tissue mobilization for the upper traps and for your upper back muscles to kind of help work on tightness we get in those muscles as we're stressed. There's a lot of things you can do to help this, such as stretching, but this is a way you can kind of get some massage in there on your own and try and loosen these muscles up. So let me show you on the poster here kind of what we're going to be working on. So all of the shoulder blade muscles, you can see the shoulder blade here. We want to target between the shoulder blade and the spine. So but like you can see, there's a lot of different muscles here. As long as you're not pushing right on something that feels bony, it's going to be okay. And there's that upper trap there as well. So let's start with the upper trap. First of all, what am I using? I'm using a lacrosse ball here. Sometimes I'll have patients try like a tennis ball, really whatever you have at home you can give a try, but we do really like to use the lacrosse balls here in clinic. So we're gonna, like I said, hit that upper trap here first. So I'm gonna place it on that soft part of the upper trap. It shouldn't be so far forward that you're hitting your collarbone here, not so far back. Well, you really can move it towards the back a little bit, but like I said, you're trying to stay off of bony things and keep it on the soft muscle tissue areas. So I'm gonna kind of put that there. Then I'm gonna use the wall, a door jamb here, somewhere that's, you'd have space for your head, I guess, but usually the door jamb works really well for this. We're gonna use the door jamb to trap that ball in between my upper trap musculature there and the wall. So find a spot that has some tenderness and you're just gonna hold that 30 to 60 seconds here. Ideally with holding, you feel that sort of loosen up a little, or you feel something change. Maybe it doesn't feel like as much pressure or it's not quite as tender. That's telling us something's changing in that muscle. And then at that point, if you want to, you can add some movement. So I could do kind of bending my head away from the door frame. I'm kind of putting some stretch on that trap and then coming back towards the door frame. And really that's just letting us lengthen and shorten the muscle, and it's kind of running the soft tissue work along the whole muscle with that. So now we'll work on the back side of the shoulder. I like to use a pillowcase here. Just drop the ball in there. And then it's really easy to control back here by just using the pillowcase. Otherwise it's hard to place that ball in the right position, but this makes it pretty easy. And then I'm going to, once again, use the wall to get my pressure. So if I bring my arm across my body, my shoulder blade kind of follows, and then it opens up more space for me to dig that lacrosse ball in back there to those tender tissues. Once again, holding that pressure 30 to 60 seconds. If I want to, I can then add some different motions of the arm. And you'll notice as you move, if you're on a tender spot, some positions will be, ooh, that's a little bit more tender, others less. But you can add the motion like this, or you can just do the static hold, and after 30 to 60 seconds, move that to a different spot and hit it again. So give these techniques a try at home and see how they work for you.